So you went to a therapist, told them about your problems, and they gave you a diagnosis. But what does it mean? And how are you supposed to feel about it? And what exactly are you supposed to do with this new information? Being told you have a mental health disorder, like major depressive disorder or generalized anxiety disorder, or a developmental disorder like ADHD, well, it can leave a person feeling, well, disordered. I mean, on the one hand, you went to see a therapist because something was off, and now your therapist has given it a name, which can feel really validating. But on the other hand, does this mean there's something wrong with you? And what does it mean about your future or how other people are going to think about you? First, let me give you my little spiel about diagnosing yourself or anyone else with a disorder. It's really important to keep in mind that making a diagnosis isn't just about reading over a list of symptoms and deciding whether it sounds like you. And while some of these disorders might seem pretty straightforward and obvious, it is always best to go to a trained mental health professional if you think you might have a mental health or developmental disorder and not, TikTok. I mean, seriously, put all of your fingers down and stop diagnosing yourself and your friends on TikTok. Right. So now let's talk about how mental health professionals, like myself, go about making a diagnosis. When it comes to deciding if someone has a psychological or developmental disorder, we need to answer 3 big questions. The first question is whether the problems the person has are outside what we would consider the normal range of human experiences. For example, we all get sad sometimes, and we all have low self-esteem moments. Most of us go through periods of time when we don't feel like going out with friends. These are all normal human things. But it isn't considered a normal human experience to feel extremely sad for 6 straight weeks, especially if there isn't anything else going on in your life that is clearly causing the sadness. It also isn't usually thought of as normal to withdraw from friends for months at a time, especially if your normal is being extroverted and outgoing. And since those things aren't considered normal per se, that's our first clue that the person might be suffering from some kind of mental health condition. The second question we need to answer is whether the symptoms or traits are creating problems for the person. After all, a disorder, by definition, is a problem. So if the symptoms or traits aren't causing problems, then there isn't a problem, if you get what I'm saying. So let's say you're easily distracted and extremely energetic, but your job is super active and doesn't require you to focus for long periods of time. It also isn't causing problems in your relationships. So if it isn't interfering with you living your best life, then it isn't a disorder, even if it sounds a bit like ADHD. The last question we need to answer, or at least investigate, is whether there is a medical condition that could be causing the symptoms. That's why your therapist might recommend that you meet with your primary care provider to talk about what's going on with you and maybe even have some blood work or other tests done. There are many physical health conditions that look a lot like psychological disorders. The brain, after all, is connected to the rest of the body. Okay, so let's say your therapist or doctor decided that the stuff you've got going on does in fact warrant a mental health or developmental diagnosis. So what do you do with this new information? How does it help you? First and foremost, having a diagnosis guides what kinds of therapies or medications you might benefit from. Maybe you've heard the phrase evidence-based treatments. So that refers to the decades of research that's been done on different kinds of interventions and how they work for different disorders. So assuming your diagnosis is accurate, it makes it easier for therapists and med management providers to figure out how best to help you. It can also help you figure out which accommodations you might benefit from at work or at school. On a more practical level, a diagnosis is often necessary to qualify for certain kinds of therapy, medication, or accommodations. In fact, insurance plans usually won't cover therapy unless the person has a diagnosis. So having a diagnosis can also make it easier to explain to friends, family, coworkers, and other people why you're having a hard time with something. And while I don't necessarily recommend putting your diagnosis on your business cards or your online dating profile, letting your boss know ahead of time that you have panic disorder might be a good idea if you think it's possible a panic attack could mean you suddenly have to duck out of a conference room in the middle of a meeting. And that leads me to the last thing I want to say about getting diagnosed. It's important to remember that having a mental health or developmental diagnosis hardly ever means that you can't be successful at work, in relationships, or at school. It just means you may have some obstacles to work around that other people may not have. Just like someone with a physical disability or illness, like asthma, for example. Getting diagnosed with asthma doesn't necessarily mean you can't be on the track team or run cross-country, but it might mean that you need to keep your inhaler close by, and maybe you have to bow out once in a while because the air quality is bad. There are literally millions of examples of people with significant physical disabilities who go on to accomplish amazing things once they've found the right accommodations and treatments to help them achieve their goals. Psychological and developmental disorders are no different. Getting a diagnosis can be scary, sure, but it doesn't change a thing about who you are. A diagnosis is just a guide you can use to help figure out how to achieve your goals and be the best version of yourself.